animal poison control for cats is the purposeful or accidental ingestion of human medications. If you have aspirin, you can give aspirin or Tylenol to a cat, but it is a tiny dose, almost a microscopic dose, and it's given every few days. And so there's thousands, tens of thousands of cats every year killed because somebody tried to give them an aspirin or acetaminophen, or they accidentally ingested it. Pepto-Bismol, same thing. Pepto-Bismol has an aspirin-like compound. Dogs works wonders, but cats doesn't work so well. But there's a lot of things we use in cats. Everything from unscented baby wipes to wipe them down. It dramatically reduces allergies. You can use kaopectate for them for diarrhea.
And didn't am I recalling correctly, like Benadryl was actually
Benadryl for antihistamine for allergic reaction, and one of the other things too that's really good for cats is probiotics. They tend to have a gut that gets stressed out a lot too. And we think about. I remember as a kid, I grew up on a dairy farm in southern Idaho. And we had that proverbial cat that when you were stripping the cow, if you'd done to the milking machine, you cleaned the last of the milk out. And when you strip it, you could squirt it clear across the barn, and the cat would sit up on its haunches and drink that milk. But in real life, most cats are lactose intolerant, and they actually don't do very well on milk. Canned pumpkin works great for hairballs. So not the spicy kind, not the things that, but the unspiced canned pumpkin, a tablespoon once a week, helps those hairballs feed right through in a nice, natural way.
Wow, cool. Well, again, this is Talking Animals. I'm Duncan Strauss. My guest is veterinarian Dr. Marty Becker. You might know him from Good Morning America or the Dr. Oz Show. And his new book is Your Cat, the Owner's Manual. We invite you to join the conversation by calling 813-239-9663 or emailing dj@wmnf.org. We do have kind of a flurry of emails here as well. Let's read one of those. My 13-pound dachshund suddenly developed a twitch in her neck. It is strong and bilateral. It causes her ears and shoulders to move. My vet can offer no reason for it. She has full range of motion with no pain. Can you offer any clues? Thank you.
I love dachshunds, by the way. I always joke, everybody has their inside humor. I always call them 2 dogs long and a half a dog tall, I love dachshunds. There's a couple things it could be. The most common thing would be some kind of a slip disc in its neck. They're very prone to intervertebral disc disease, and it could be one that's just putting pressure in something that's causing muscle spasms. That's what it actually sounds like. And muscle spasms is a result of irritation to the nerve. So I would recommend getting some imaging done so you could look and see if there's a narrow disc space. And if it was, it could be something that might be handled by anti-inflammatory drugs and some antispasmodics for the spasms, or it might be something that required surgery. The other thing would be, if it's on a regular time, could be an epilepsy. And again, those are easily controlled by generics. I have an epileptic dog myself, and it's one of those things they don't have to suffer from it. So it could be kind of a petite ball kind of seizure.
Yeah. All right. So Dr. Becker, again, just sort of skipping around from stuff in the book, and we'll sort of keep interspersing some calls and emails. But over the years, we've done entire shows devoted to the topic of declawing, and I know it comes up a few times in your book. So I just think it's a message that completely bears repeating whenever you can. Maybe just talk about declawing and sort of, the cons and the cons. I don't know about there's pros and cons in this one.
I have to go back to, I've been a practicing veterinarian for 30 years, and we used to declaw routinely. I did ear crops, which to this day, every time I think back of the dogs that I cropped their ears on, I just think, why did I do that? I feel so bad for them for something that was just cosmetic. And now, I practice in northern Idaho,